So let's say you have a client here coming to standing, yeah, and this client carry this bag like that and lift your shoulder. Come, sit, no, sit. You can come and sit here. Still sit here. And this client, to get the strap not falling, putting the shoulder up. Yes. So what happened to this muscle? It's get contracted more, right? So the motor nerve get more and more contraction, and slowly what happened that it will build tension and then strain. Yeah. Another possibility is that there would be an injury to that muscle. Let's say you do some sport and you're trying maybe to do some lift weight or boxing, and then that muscle would get strained, which means tear. Yeah? It doesn't matter if it's a slow and progression contraction or fast injury, a strain will happen. So now we want to unwind that muscle. We want to make it soft and normal again. So with the normal massage technique, you can do that, but we try to learn now a new technique that will add on to your ability to help these muscles that call positional release. So you're looking actually to massage this muscle in a position in which release the tension. Yeah? Or another way is if you have a strain, you want to counterstrain it. Yeah? You want to undo what the problem is. Yeah? So let's hop onto the table, please. Again, I'm not going to do the actual massage, but I'm just going to give you the ideas, and then after that we'll develop really the massage technique into. Come and lie down on your back, facing up. Good. Now you need to come, you can still sit, but come a bit closer. Okay. Now, let's say that it's the same shoulder. So that shoulder is a little bit higher. Yeah? Does it make sense that it will be a bit higher? Because there is some tension there. Yeah? Now, usually, you would do your effleurage and pétrissage and even compression, but that's so far what we've learned. And we're trying to add on another string to our bow when it comes to helping this client. So imagine that this muscle is more or less like the towel. So it gets a bit tight, a bit contracted. So what is our first intention to do? Everybody think, oh right, let's stretch it. Yeah? So the muscle is tight, but you actually try to stretch it. So instead of sometime release, what that stretch cause is that the muscle think, oh, I'm tight, and somebody wants to do some opposite to what I need to contract more. Yeah? Why? Because this muscle connect to the brain, and when this muscle feel the tension of the stretch, you say, wait a minute, something is spooky happened here. I don't want to take the chance of having more tear. I contract. It's a protective mechanism that the body has to contract these muscles. So at times it would work, a stretch would work, but what you find on an injured area, stretch is not recommended because of that reason. So what you can do, if not stretch, is actually putting the muscle into a lax position. A lax position, if this is this muscle, imagine there is a tight knot here. So a lax position would be to relax it. And then try to massage it, improve the circulation. We've done it before, remember? A few times. But I want to bring it more to your awareness about how that there is a proper technique that called strain counterstrain or positional release. You're looking for the position to release it. So let's look again on the upper trapezius. Yeah. Let's say that you have can I take this a little bit up? Yeah. Let's say that there is a knot here and the muscle is quite tight. So instead of trying to stretch it, I will just take the elbow here and push this muscle a little bit above. And now in a relaxed position, I would petrissage it. And then maybe a little bit stretch. And then again, put it in a relaxed position. And again, petrissage it. And good. Even keep that in here. And then do a bit of turning, or a bit of turning onto the other side even, to relax it even further, and then massage it. So you see, massage, it's part of it, but is the position that we're looking for the release to happen. Let's take another issue. Petra, come around to the other side. Yeah? How about putting that muscle in that position, and then trying out? There is no recipe to the position that the release will happen, but after some experience, you will get hold of it. So you're trying to really find where this position would release. Maybe a little bit there, or maybe down. Compression and release. And then compression and release. Okay? Let's, for example, take another muscle that you can have that. Any other idea?
Calves?
Let's take a calf muscle. Okay? So let's stop the camera for a second. So we are at the calf. Yes? Can you give me an example to an injury that can happen to the calf? A reason to it?
Jogging.
Jogging, yes. Maybe on an uneven pavement, and you can stumble and then contract this muscle. Playing football.
Or even wrong shoes, probably, when you wear wrong shoes.
Maybe. High heel shoes. Yes. These muscles. Can you walk on high heels? Can you try that?
Can.
Yes. You're contracting this muscle a lot. How about overstretching? When you try to stretch really hard and you're bouncing, yeah? Not a good idea. That can bring a tear to the muscle. And then, what would be the reaction to the muscle, to the tear? Contract. Yes. So we are there into this cycle. You see strain and contraction, and you may want to stretch it because you feel it contract, but actually not very good. The muscle's reaction to the stretch would be contract even more because the muscle wants to protect itself. So, so here you are. You can arrange the clients. You can start by, where is the oil? Here. Let's take this time and do a little bit more specific treatment to the calf muscles. Which two muscles are there? And soleus, great. So you start by doing effleurage, and you may feel it already, or you do petrissage, and there might be a lot of tenderness, and you try compression and you think, okay, well, it seems tight, and there is almost like no way in. The muscles deflect you, and you almost feel the muscles say, stop, I don't want it. I really don't want you to get into my life right now because you're just aggravating the situation. You're thinking that you're helping, but actually it's not helping. So, do you have any idea about how to put this muscle into a lax position? How would you do that? Stop it there. How would you put this muscle to relax it?
Not plantar flexion, those, I don't know.
Mm-hmm.
Would you just...
Yeah,
Left side.
yes,
Oh,
yes.
okay.
Can you feel that? Feel that and see how much it moves
No.
and see how much now it moves. Because that muscles attach above the knee and it dorsiflex. I'll do that. Do you see not much movement? And you see now how much movement? So you need to know your anatomy, but also give it a try and try. Okay, so this is a laxed position. So how can you keep this muscle laxed? First of all, you can bring your leg and put it in here. We've done that, you see? Right? And now the muscle is a lot more laxed. And now really you have to come and listen to the muscle. And it's quite interesting because you can't force the body to relax. You need to speak the language of convincing. Yeah. So you just look for the tenderness and then just keep it there. Do a little bit of pressure, and also it works on a psychological level that the muscles feel, it's actually not too bad. I can let go. And then you do more. Yeah? You change your position. Maybe you play a little bit with it. You say, okay, let me tighten a little bit. Let me lax a little bit. Yeah? And your hand tells the story of, you see, life is good. You can let go. You don't need to tighten that much. You can relax. If you cause too much pain, it's like Monopoly. You're back to jail, to square one. So you have to be quite careful, but not too careful. If you're too careful, you're not effective. You're not effective. So you're trying to be effective, yet not having this spasm or tension happen again. Okay, good. Now you can do it also in other position. You can bring your hands into here and then, move, squeeze the muscles to the side. And how do you know how much? The muscle will talk to you. Listen to. If it's too much, the muscle would get into, cramp or contraction or small, you feel spasm, small spasmish things going on there. You're saying, okay, it's too much. Good. And then other side. Good. Good. Hamstring, pretty much the same thing. Yeah? If your leg is straight, the hamstring is tightened. If your leg is bent, then the hamstring are softened. You can do that, okay? Shall we try these through areas? We try shoulders, calf muscles, and hamstring.
Mm-hmm.
And I would like you to look after to another group of muscles that we haven't done and see if you can accommodate new technique. You have to, in a way, to reinvent it. I'll be around you and I'll help you, but try to reinvent a technique that will put the muscles into a position of release, and then, like in massage, it might be in the forearm, it might be in the triceps or biceps, yeah? Anywhere that you want. It might be in the quads, but I want you to take what you've learned and try to move into a new area and see if you can.